Welcome back. Among the economy, Supreme Court, and race issues, COVID-19 took center stage at last night's vice presidential debate. From safety precautions before the candidates even stepped on the stage to increasing cases at the White House, there's a lot to unpack here. So we're bringing in our 9Health expert, Dr. Payal Kohli. Good morning, Dr. Kohli. My first question is about the safety precautions seen at last night's debate. Did you feel it was adequate enough?
Good morning, Natasha. In my opinion, I really felt that this debate should have been held virtually. The White House is really a hot zone of viral activity. Vice President Mike Pence has been exposed to not one, but several people who have tested positive for COVID-19. And according to the CDC criteria, if you have been exposed to somebody who then goes on to test positive, you really do need to quarantine for 14 days. And that's regardless of whether you have a negative test or not, because we know that testing is not foolproof. Now, we know that this virus spreads by two main mechanisms. The first is large droplet spread. That's pretty easy to visualize. It's where those droplets that kind of come out when you cough or talk or sneeze fall to the ground. And you can protect against those by spacing the desks 12 feet apart, like they did yesterday, by adding those plexiglass barriers like they did yesterday. So that's pretty easy to control. But the second mechanism of spread, which is aerosol spread, and the way to visualize that is think about cigarette smoke. It can go anywhere, it can travel really far, and it's very difficult to contain. So of course, the University of Utah tried to put in air filters, but they were only exchanging the air once every 2 hours, which is not adequate to control aerosol spread, and those plexiglass barriers will not control it either.
If you were on Twitter last night, you saw a lot of people playing doctor on there, diagnosing from afar when they saw Vice President Mike Pence's pink eyes during the debate. What was that all about?
It's difficult to speculate exactly what's going on with the vice president, so I don't want to make any conclusions. But certainly COVID-19 infection can involve the eye and have ocular manifestations. And those are usually most commonly pink eye or red eye. You can also have swelling of the eye, tearing of the eye, or increased secretions. And any secretions or tearing coming out of the eye is actually considered infectious. Now, in a hospitalized patient study from China, they saw that 1/3 of patients that had COVID-19 did have involvement of the eye. So it's hard to say what was going on with the vice president, but certainly I would worry that COVID-19 can present with ocular manifestations.
He and Harris did test negative before the debate, so we'll just have to see what unfolds with that. And also I wanted to ask you regarding the breaking news that we've been covering this morning, what do you think about the call by the Commission on Presidential Debates to hold the next debate virtually?
I think it's brilliant. And like I said, I think this one should have also been held virtually because there's really absolutely no reason to, one, expose the president to risk and two, expose the other. So let's talk about the president's health. He's been taking dexamethasone, which is a steroid that suppresses your immune system. So he's really functionally immunocompromised, and putting him in contact with other people can certainly expose him to risk. And then, of course, there's the issue of how long he's infectious. Now, the CDC says it's usually about 10 days after symptom onset on average, but we know that the president has gotten many therapies that can modify that timeline, including the steroids, the remdesivir, and the antibody. So it's hard to know how long he'll be infectious unless we check a viral load. And we certainly don't want to expose others to risk, especially given what we talked about with aerosol spread.
All right, Dr. Kohli, thanks so much. Nice to see you.